While that is a heroic story and we praise the employee for saving the girl's life, we are joined now by emergency physician Dr. Willie Franklin from Adventist Health to tell us more about the Heimlich maneuver and how to perform it safely. Good morning, doctor. Thank you for joining us.
Good morning. Thank you.
So tell me, what are the signs of someone choking?
They will be coughing or trying to cough. They're not breathing. They can't breathe. Sometimes they're grabbing their neck. That's sometimes a good sign. If they can't move air, you won't hear any noise from them. They won't be able to talk or grunt or anything if their airway is completely obstructed.
And what should you do immediately in that situation?
If you know how to do the Heimlich maneuver, you should definitely start doing that, and you should call 911 because you need people there right away that can do advanced airway if needed. People choking are in big trouble and they need your help.
Now, doctor, give me some ways for people who do not know how to do the Heimlich maneuver. How can they train for a situation like that?
Well, there's certified courses probably through the American Heart Association, American Red Cross. Just like the course that you mentioned, they'll probably also go over the Heimlich maneuver since they're doing hands-only CPR. That's a lot of places where you can learn the Heimlich. The basic life support course from the American Heart Association will teach you the Heimlich maneuver as well. So it's good to get trained in it before you do it, but...
Yeah. So, doctor, give me the mechanisms of how it works. We know the Heimlich maneuver, we know the mechanisms, but what is it supposed to do and what's the purpose of it?
So the purpose is to dislodge something that's in your trachea, which is your windpipe. When you do the Heimlich, it's kind of you're putting pressure down in here and you're using the air that's already in the lungs to expel that forward. So you kind of want them to be leaning a little bit forward so that thing will come right out. If you get enough pressure in there, that's the point.
Now, I'm obviously not choking right now, thankfully, but could you kind of use me as a dummy and explain how to do the Heimlich maneuver for those at home?
Okay, sure. The basic thing I'm going to show you is that you would get behind the person. You kind of want to balance yourself with your feet. You're going to get your fist right here in this part of the belly, and then you're going to push really hard, try to get that to expel the object out.
Gotcha. So it's kind of a push in and up.
Correct.
A little bit?
You want to go up. Yeah, you don't want to go straight in. You want to go up.
Gotcha. And you never think you're going to be the one in a situation where you have to perform the Heimlich or that is required. Someone is choking and you're the one there to save them. How important is it to know these life-saving techniques?
Very important. Everybody can do it. Everybody can get trained in it. Everybody can do it. You don't have to have a medical license or a medical training. Nurses, doctors, respiratory technicians, medical assistants all know how to do it. Apparently someone at the park knows how to do it. Yes. It's important because you can save somebody's life. It's going to be in an instant, and you have less than a few minutes to save that person's life.
Goodness.
So getting to know how to do it's very important.
You said less than a few minutes.
Less than a few minutes. The permanent brain damage can start within just a few minutes of choking. So you really need to get in there and get that object out.
Now, doctor, not everyone at home is trained in the Heimlich maneuver, but these situations, these choking situations can really pop up anywhere. Should they intervene if they're not trained in it?
I think if there's no one around and there's no one else that can do it, then I would say certainly try. You're doing something that there's a high risk of bad outcome if you don't do something, and so at least trying. But I would, even if you just today watch a video on YouTube or something about how to do it, just so you learn some of the basics so you can be ready to do it, because it's going to be, you're not going to be expecting it. You can be walking down the street and all of a sudden you got to do it.
Right.
You got to do it now.
Stories like these just remind us of how common it is. I mean, it was just at a trampoline park at a birthday party. So it is so important to know these techniques and to also know to call 911, to be ready and able in those situations to help out the best way you can. And I like that you said, even just watching a YouTube video, if you can't make it to a class today, knowing these techniques can save lives.
Absolutely.
And I like how you mentioned 911, Lauren. You're not out of the woods yet. Once you stop that person from choking, why should they call 911 and have that person receive medical treatment?
Because there can always be injuries that go unrecognized immediately at the scene. I see people all the time that had a choking incident. They're fine, but they come to the ER. I want to see them. They should come and see us so we can just check them out and make sure they're going to be okay. And usually we see them, we maybe do a chest x-ray or something like that. They look fine, we send them on their way and we check their vitals. Send them on their way, but it's important to get looked at.
Well, Dr. Franklin, we are having an event at our Compassion Corner February 19th, partnering with Adventist Health and other organizations. Come out 5 a.m. to 7 p.m. This is next month, February 19th. We will remind you again so that you can come out and learn these life-saving techniques and get that hands-on training. Thank you so much for joining us today.
Oh, you're welcome. Thank you.
Yes, thank you. Stick with us. We'll have the last of Sunrise in the final half hour after the break.